Social Security disability, and if your disabling conditions are something that the Social Security Administration will approve to get your Social Security disability benefits. If you're new to my channel, my name is Ed Weir. I'm a former manager of the Social Security Administration. I've taken hundreds of thousands of disability claims, adjudicated, approved, and unfortunately denied lots of disability claims. So I've got experience on the inside, and I'm going to help you figure out whether you should go ahead and file and how to file and tips, tricks, and secrets based on my decades of experience. This is a live Q&A as well. I do these pretty much daily recently. A lot of people out there are missing money, don't know whether they should file now or wait, and how they should file, or if you're currently receiving benefits, are you getting the correct amount? So I'm helping everybody throughout the country make sure they're getting all they paid into. And so if you got any questions, just go ahead and type your question into the live chat there. It looks like we already got a lot of questions. So let's go ahead, stop stalling, and get right into the disability part. This is only last about 10 minutes, the disability part. And then I'll get into your specific questions on disability, retirement, Medicare, Medicaid, all the rest of it. But first of all, I need your favor. I need a favor. There's an internet myth out there. You probably heard someone say it, that everybody is denied disability the first time at Social Security. Please stop repeating that myth. It is 100% incorrect. I know for sure because I have approved thousands, tens of thousands of disability claims the first time. There's some claims I've taken in Social Security offices throughout the country. You file in the morning and your case is approved that day or the next day. I've had many cases like that, terminal cases, and fortunately, terrible disabilities, but those are approved based on a compassionate allowance and algorithm that Social Security uses that approves those automatically. So there are a lot of claims that are approved the first time, a lot of claims that are unfortunately not approved the first time that should have been approved the first time. But repeating that myth out there, what it does, the people that really should be getting disability benefits, because of their disabling conditions, they're having financial hardships, or having issues with their disability, and if they just hear someone around them say, well, you're denied the first time anyway, then that kind of dissuades them from go ahead and file, and because they're already kind of downtrodden based on their life situation, and you're not helping by repeating that myth, because then they won't file and they just might get approved and get some money, and then health insurance, you get health insurance, Medicare, after being on disability for 24 months. I know it's a terrible system. I think you should get Medicare immediately. You get your first check, you get Medicare, but let's make sure that changes. But please stop repeating that myth. You're just doing people a disservice. One of the reasons I think it's perpetuated is people just like repeating negative stuff, but I think there's also maybe disability lawyers. I always hate talking about disability lawyers because they're so litigious, and they might do something, but anyway. But disability lawyers, they kind of want you to believe that, so you'll hire them to take your case, and which is fine. If you wanted to use a disability lawyer, more power to you, with the understanding that if you're approved, they don't charge you up front, but if you're approved, they get 25% of your back pay, up to, this year it's $7,200, and lawyers negotiated with Social Security, and they raised that to, starting November 2024, to $9,200, to up to $9,200 of your back pay. And as I always say in this video, and in all my videos, if you're going to go ahead and hire a lawyer, I don't really recommend it for the first two stages, because the first two stages, the initial claim and the reconsideration, those are relatively easy. Again, if you want a lawyer, go for it, but the lawyer is just going to ask you basically the same questions that are on the application. So you can pretty much do it yourself. You can do it online. I've put together a series of videos that will help you out. Let me go ahead and show you those videos that I did. Let's see here. So I did a series of 3 videos on the appeals process, what an onset date, the SSI versus SSDI, file common mistakes, the insider guide, so the whole process, the medical records, should you provide them directly? Should you have Social Security get them themselves? All of that I talk about in these 3 videos. So if you're looking to go ahead and file, watch these 3 videos. And again, if you want to hire a lawyer after that, again, I kind of hesitate, to tell you not to hire a lawyer because, but on the last stage, the administrative law judge, where you actually go see a hearing, yeah, 100% you should hire a lawyer. Get a lawyer. Again, if you don't win, you don't pay them anything. But yeah, on the last stage, I think a lawyer is good. And I recommend local attorneys that kind of know the local judges. If you don't have anybody in your town, just email me and I'll find someone for you. Probably not in your town, but there's other organizations that'll be able to help you out. So just email me and I'll give you a referral. All right. So in terms of your particular disability, people ask me all the time during my live Q&As, can I get disability for X, Y, and Z? Can I get disability for this? There is obviously, cancer, and, if you have a terrible car accident, or, you have, several heart attacks, and, Social Security defines disability as the inability to work. So whatever you have, whatever disabling condition you have, if you believe that is preventing you from working, not from finding a job, because everybody can find a job. Everybody can find a job. Whether you can keep it for more than an hour, that's a whole different thing. You can find a job online, and then, because of your disabling condition, you're not able to answer the phone, or, be there on time, whatever the case may be. So, don't think of it as, well, yeah, I could probably find a job. Yes, everybody can find a job nowadays, internet and all that, but can you keep it for more than 5 minutes or an hour, a day, or a week? That's the situation. So Social Security defines disability as the inability to work, but you can work and receive disability benefits, but it's called substantial gainful activity, SGA. If you're only able to work and it's only under $1,500, $1,550, then anything over that, they consider you're able to work. But if you're earning under that, so if you have a disabling condition, you're able to work, 4, 5, 600, up to 1,550 a month, then you should definitely file for disability. And particularly on your disabling conditions, what I've seen is people say, well, here's what I'm focused on. Here's what I think my disabling condition is. Can I get disability for that? People ask me all the time in my comments during live Q&A. I say, file. File, file, file. Go online, call the 800 number, schedule an appointment, but file for benefits. Because what I often see is people focus on what they think is their main disability, but then through the process, they say, well, yeah, I have this disability, but I also have these 3 other smaller things that I don't really commit. But they factor into the larger disability, and your larger disability, you're taking medications for that. And the side effects are, like, for instance, if you have, some type of medicine that makes you go to the bathroom 20 times a day, are you going to be able to keep a job for more than, a week if you're always in the bathroom, if you're falling asleep all the time? So a preponderance of the disabling evidence is also crucial. And it's Social Security's job. Yes, they're understaffed. It's the reason they're understaffed is politicians want to give it over to Wall Street, but I won't go there right now. But they're understaffed, 50-year low in understaffing. Yes, it's a nightmare. Yes, it takes forever. Right now, when you file for disability, on the initial stage, they tell you it takes about 6 or 9 months. When I was taking disability claims a few years ago, we told everybody 3 to 6 months. But now with the understaffing, they're being told 6 to 9 months. So yes, it does take, unfortunately, way, way, way too long. And there's strategies. If you're 62 or older, then you can file for retirement benefits and start getting your retirement benefits while you're waiting for your disability benefits. It's called RIB-DIB. So super long story short, I don't care what your disabling condition is. If you think it prevents you from working, please file and focus and watch those 3 videos. Put your major disability first, and then your other disabling conditions that may add on to that. And again, the side effects of whatever medications you are taking. Send that up, and what happens, I talk about this longer in the videos, but you file at your local Social Security Administration office. or online, phone appointment, in office, whatever the case may be. And then they send it up to what's called the DDS, Disability Determination Service. Or those are the people that make the medical decision. It's a state, federal type of agency, and they get all your medical records and make that decision. If you're denied, the next stage is called the reconsideration, which is super, super easy. You can do it in about 10 minutes. So then you file reconsideration, and then a completely different person looks at that particular case. And then if you're denied there, then you go through the administrative law judge, which unfortunately to get your day in court takes anywhere from a year to the current commissioner is trying to reduce that. I think he's doing an excellent job on a lot of things, but he needs our help by poking your politicians with a sharp stick and say, hey, support Social Security Administration. So there's my spiel on that. All right. So yes, if you have any other specific questions in terms of Medicare, again, you get Medicare after being on Social Security disability for 24 months. And I'm sure we'll hear a lot of questions. So let's go ahead and get those right now. Let's start the question and answer. If you have any specific questions on filing for disability or spouse benefits or survivor benefits or anything. All right, first one, Mike, new member, great. Yes, Mike joined yesterday, awesome. And yes, scheduled a private consultation. 99.9% of my help is through the free is through these videos, and I've got a team that helps you with Medicare, Medicare Advantage, Medicare supplements. That's free, but to pay kind of the the phone bill and stuff, I do a few private consultations every day. All right, Sandy, I'm not going to pop this up here because it has a company name and I tried to stay neutral. I switched to XYZ Medicare Advantage plan. If I don't like it, I can switch back in October to December. Yes, that is correct. So the new Medicare Advantage plans come out October 1st, and there's going to be an incredible amount of changes for 2025 based on a whole bunch of things I talked about yesterday and a few days ago. But yeah, you definitely need to change your plan. And again, I've put together some people that can help you out because I was tired of people doing the wrong thing. So it's the old Marine Corps thing. If you just do it yourself, you can't find someone to do it. So anyway, yes, big changes for 2025. You can definitely change your plan. And if you do it, if you change your plan between October 15th and December 7th, then your new plan will take effect January 1. All right. I am receiving benefits from my ex's earnings. How do I find my PIA, and can I find my ex-husband's PIA? Yeah, your PIA, you can call Social Security. You can go online to Social Security, SSA.gov. So your PIA, your primary insurance amount, is basically your amount at your full retirement age. So even if you took your benefits early, everybody has a PIA, and your spouse has a primary insurance amount as well. So you're receiving benefits on your own record. So if you filed at your full retirement age, then that's what your monthly benefit amount is your PIA, because you filed at full retirement age. And your spouse benefits is up to 50% of your spouse's primary insurance amount if they're still living. If on a surviving spouse claim, you get up to 100% of that person's benefit amount, not their PIA, because they might have filed late or after their full retirement age and get those delayed retirement credit. The whole thing is crazy. That's why Social Security has over 20,000 pages of policy. And unfortunately, because it's so complicated, too many people are missing benefits and they're not doing the right thing at the right time. So that's why after a week of retirement, I came out of retirement and here I am. Let's see, another person. I got a letter from XYZ plan about a plan I called MAPD. Yeah, MAPD is Medicare Advantage Part D. So you can have a Medicare Advantage only. A lot of vets that use the VA just get the Medicare Advantage only because the Veterans Administration, because they can negotiate drug prices. They got great drug prices. But MAPD includes the Part D part. So I about a plan called the MAPD plan to add to my Medicare Part A and B. Does that sound okay? Yes, yeah, 51% last time I've seen of people add a MAPD or Medicare Advantage to their Part A and B, because you have two options. You can get with your original Part A, Part B, you can get a Medicare supplement, the plan N or G, or you can get a Medicare Advantage plan. If you get a Medicare supplement, you also have to get a prescription drug plan. The pond, need help with Medicare. Yes. So you can call that number, email me, or probably the best is to scan that little QR code and a little thing pops up. And then once the new plans come out, we'll get you all checked out and review your plan 100% free and determine whether you're in the best plan. If you're in the best plan still for 2025, then you don't have to do anything. Your plan automatically renews. Also at 61, just getting SSDI, found DI at 1020. What is odds of CDR? Yeah, they put a short little pause on CDRs, the continuing disability reviews. Looks like they're going to restart them after the fiscal year starts October 1st. So yeah, it really depends. As I've done a bunch of videos on CDRs, don't sweat it until you get it. And then when you get it, fill it out. If you got any questions, come back here and we'll walk you through the process. But yeah, don't sweat CDRs. Social Security stresses too many people out about CDRs. If you're disabled and you know you're disabled and you're unable to work, then you've got no worries. Then when you get it, just fill it out. That's not true. I received SSDI the first time around. Yep. See, Linda agrees. Yes. Again, I've taken, a lot of disability claims that were approved the first time. So Linda's was first time too, right? So good. Thank you, Linda. Good afternoon, sir. Thanks. Yeah, you're welcome. Even on Saturday is leaving California. There is a particular company leaving California. There are a lot of companies leaving particular areas. I don't think that particular company is leaving California, the entire state, but they are leaving particular areas. What's happening is, I talked about this yesterday and a few days ago as well, that because of all kinds of different things, the Inflation Reduction Act, Medicare is starting to pay more and making more regulations in terms of, holding these Medicare Advantage companies accountable, making sure they take care of you. It's costing them more money and they're able to make less profits. So what they're doing is they're pulling out of particular areas. So if you're in a big city, your Medicare Advantage plan is probably still going to be there. You should definitely check to see if there's a better one. But if you're outside of a big city in the country, a rural area, out in the desert or something like that, then yeah, the companies are pulling out of those areas. There's a couple of big companies that are dropping 10% of their people. So tens of thousands, hundreds of thousands people are going to be dropped this season. So you might have already received a letter. I've had some people yesterday during my live Q&A that Medicare Advantage said, bye. So they have to find a new plan. But the good thing on that is if you always wanted a Medicare supplement plan, but couldn't pass health underwriting, now you can get a Medicare supplement plan through a guaranteed issue because your Medicare Advantage plan is abandoning you. So yeah, so click on that button, email me, call, and we can help you out and find you a new Medicare Advantage plan or switch you to a Medicare supplement plan. I got it first try, no lawyer. Yep, there you go. Well, so that whole internet myth about everybody being denied the first time, please, let's stop it. That's kind of does a disservice. If I make more than $22,000 next year, they say I'll lose $1 for every $2 over that amount. Okay, when do they recoup that? How do they recoup it? Thank you. Yeah, good question. Aunt Lynn. What's up, Aunt Lynn? Not my aunt, I don't think. Are you my aunt? Anyway, yes. So how they do it next year, it's not the 22,000. They haven't come out with the new numbers yet, probably at 23 or 24. But anyway, so if they go over that amount, there's a couple of ways you can do it. You can call them up and call up Social Security and say, hey, I'm going to make $30,000 or I'm going to make $10,000 over the annual earnings limit for next year. So what they'll do is they'll hold back $5,000 for the benefits. So, if you get $2,000 a month, then they're going to hold back the first 3 checks. Wait a second, I said 5,000. They can't hold back partial. So they'll hold back the first $2,000 check, the second $2,000 check, and because there's $1,000 left over, they'll hold back the third check, all of it, all $2,000. The good thing is that once you hit your full retirement age, they readjust that and unreduce your benefits. I've got a video on that. It's called How to Unreduce Your Reduced Benefits. But anyway, in your particular case, so if you don't want to call them up or you don't know how much you're going to make over or something like that, then what a lot of people do is, and the source of a lot of overpayments is people just say, oh, let it ride. I'm only going to be, $2,000 or $3,000 over. So if I'm only going to be $2,000 over, I'll owe Social Security $1,000. And what happens is the following year, when you do your taxes, because Social Security doesn't know until you file your taxes. You file your taxes, the IRS notifies Social Security. Social Security looks at the numbers and say, hey, you went $2,000 over, you owe us $1,000. They send you a nice little letter that says pay up. And at that time, you can just pay them the $1,000 or set up some type of payment plan. So those are your two ways to address that. Either call them up and tell them to stop your benefits for that month or 2 months or whatever, or just let it ride and get the overpayment and deal with it at that time. Lily, can you draw Social Security while on disability? Absolutely. So Social Security disability is Social Security. So, but you're talking about Social Security retirement. Yeah, absolutely. But not your retirement on your own. You can, because survivor benefits is also retirement and spouse benefits are also retirement. So you can be receiving disability benefits on your own record and be entitled to more money from a spouse or a divorced spouse. So you can add that benefit on top, or more money as a surviving spouse benefit. You can add that on top. But another thing is you can file, I talked about it a little bit, the rib dib. So if you want to go ahead and file for disability benefits and you're 62, 63, 64 or whatever, and the person says, hey, it's going to be 6 to 9 months for a decision, unless you have one of those slam dunk, disabilities that's probably going to be approved, the same day. But if they say, okay, it's, going to be 6 to 9 months, and you need money while you're waiting and you're eligible for those early retirement benefits, 62, 63, whatever, then you can go ahead and file for Social Security retirement benefits and start that check coming in while you're waiting for your disability. And then once you get your disability benefits will be reduced by the number of months you received your retirement, a few dollars every month. Or you can just say, hey, I filed for my retirement, under 12 months ago. I want to go ahead and withdraw my retirement claim, pay all that money back, and then your disability will be, your benefits will be the high full retirement age benefit for the rest of your life. So that's a strategy not many people use because they don't know about it. So yeah, there's a lot of strategies that unfortunately people don't know about. And Lily, one of those is people think they can't get spouse benefits or divorce spouse benefits or surviving spouse benefits because they're on disability. And if they get that, they'll lose their Medicare. 100% incorrect. 100% incorrect. 2 questions. What's the difference between Medigap Plan G and Plan N? Is Medigap more expensive than the other 2 supplement plans? I'd rather go with a supplement plan. Other 2 supplement plans, Medigap is it's the same thing. Medigap, Medicare supplement, same exact thing. So you have Plan N or Plan G. They used to have the Plan F, but that's pretty much phased out. So the difference between Plan G and N, Plan G covers everything, all the gaps of original Medicare, except for the Part B annual deductible of $240. Okay. That's it. If you go to the doctor and you get $1 million bill, you pay $240 and you go on with your life. Plan N, same thing, $1 million, pay $240, but you might have also had to pay a diagnostic fee visit for your doctor up to $20. Usually it's about $14. And then if you have to go to a emergency room, you have to pay up to $50 unless you're admitted to the hospital. And there's these excess charges, which some states don't even allow doctors to pay. It's basically some doctors don't take the Medicare rates and they can charge up to 15% above. But all you have to, I don't think I've known anybody that had to pay that 15% because they're like, they see 2 doctors and say, do you accept Medicare rates? And they say, yeah. The other one says, do you accept, oh, we charge 15% more. Okay, I'm not going to see you. Only about 5% of doctors, hospitals, clinics charge those excess charges. And plan N cheaper. The monthly premium is cheaper. So if you watched any of my videos on Medicare supplements, you know, because I'm cheap, I like plan N. I recommend that one first, but very, 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 very close behind is a plan G. And if that's not in your budget, that monthly premium, then a Medicare Advantage. But there's a little bit more work with the Medicare Advantage because you have to keep up on it, yeah, on a yearly basis. Angel, I'm 67. I live on pain pills every 4 years, low dose for last 7 years. I'm retired and have bulging hernia. Will I qualify? No, because you are past your full retirement age, unless you can prove your disability began before your full retirement age. What happens is when you hit your full retirement age, nobody past their full retirement age is on disability. Everybody in the country who is on disability, once they hit their full retirement age, they're automatically switched to regular retirement benefits. And so it's basically a bureaucratic type thing. They stop taking money out of the disability trust fund and start taking out of the retirement trust fund. But the good thing is that your check stays the same, pay date stays the same, direct deposit stays the same, but you don't have any continuing disability reviews anymore. You don't have any work limitations anymore because you're receiving retirement after your full retirement age. So there's a lot of people out there that are on disability, or they think they're on disability and they're 67 and 70 or 80 and they want to go get a job, but they're like, I'm on disability and it might stop my disability. No, you're no longer on disability. You're on regular retirement. Do what you want. So yeah, there's a lot of people out there that could, could go out there and make a little bit of money. They would like to go out there and make a little bit of money, but they're paranoid they'll lose their disability. So please, let's share, subscribe, like, and all that kind of good stuff so people get the information. I get half of my ex-husband's income. Does this matter? Okay. You're part of that last question. Yeah, no, that doesn't matter again, because yeah, after your full retirement age, there's no more disability. But yeah, if you get half your ex-spouse's income, remember, if you have another ex-spouse or that spouse passes away, there's more money there. If you have another ex-spouse that benefit amount is higher, you can switch on to that person. So you're getting up to half of your ex-spouses. If something should happen to that person, your benefits will increase. That's automatic. You don't have to do anything. SSDI was approved in 10/20 when I was 55 for severe neuropathy. I was also okay. Can I have a Social Security review my case again? Not sure why. Yeah, you were approved. Not sure why you would want them to review it again, unless you want to stop your disability benefit. So if you're receiving disability benefits, and yeah, there is no more money. That might be what you mean. Yeah, if you're more disabled, you get more money. No. If for regular disability, there might be some more benefits for you if you can prove that you're now blind, or vision impaired. Then that you definitely need to contact Social Security office and maybe add that to your record. But anything else, no. It's not like the Veterans Administration where the more disabled you are, the more money you get. So nope, just stay where you're at. Sir, my husband is eligible to get his full Social Security benefit at age 66 and 8 months. I am 63, old, still working, and need to work for 4 years to qualify. Can I draw on his Social Security? Yes. Even if you are not entitled to benefits on your own record, if you're currently married and your spouse files, he has to file first. So as soon as he files, then, if he sets up a phone appointment and goes ahead and files for it, then he hands the phone to you, and then you file for benefits on his record, and you get up to 50%. It's reduced if you file early. But if you're working, then remember, you've got that annual earnings limit that you have to stay under to continue benefits, or not be $1 for every $2 you go over. Somebody asks, at what age do you get Medicare? You get Medicare at 65 years old, unless you are on disability. If you're on disability, you get it after 24 months. There's a couple exceptions for end-stage renal disease and Lou Gehrig's disease. Ed, thanks for all you do. You're welcome. Thank you. Thank you for the comment. Let's see here. Going through all my other questions on this other, do they really come and sit in front of your house and watch you and follow you? No. That's the YouTubers and TikTokers out there trying to scare people. I just said Social Security is a 50-year low in staffing, and no, if someone, usually it's like an ex-spouse or something, drops the dime on you and says, "Oh yeah, it says you're on disability, but you've been up there roofing and stuff like that." But what they often do is they send you documentation. Social Security sends you documentation, and kind of does a medical review, or does work review, work CDR, and sees, have you fill out all the paperwork and stuff like that. But no, yeah, Social Security just doesn't have that. I mean, if you're an obvious, scammer, and it's, multiple people have reported, and Social Security shows work, activity on your account, then yeah, they might come check you out. But if filed 62, may I receive more benefits? Okay, I'm not sure. How do I find out what is my Part B deductible? Um, yeah, your Part B deductible is the $240 a year, but then also you have the co-insurance, Part B. There's 6 gaps in original Medicare, 3 in Part A. Like if you go to the hospital, there's a deductible of $1,632, and that could be multiple times a year. For Part B, there's 240 yearly deductible. And then the big one is the 20% co-insurance. So if you go to the doctor and it's a $100,000 bill, you have to cough up $20,000. That's why people get either a Medicare Advantage or a Medicare supplement plan. Ed, can a non-U.S. citizen get their deceased spouse benefits? Yes, if they're in the country legally, if they've got legal status in the United States, don't have to be a citizen, can be a green card holder, as long as you're in the country legally. People always say, "Oh, illegals can get benefits from Social Security." No, people say, "Well, then they get it from my county." Well, your county is not Social Security. I'm talking about Social Security. You cannot get benefits from Social Security retirement, survivor benefits, spouse benefits, disability benefits, supplemental security income, unless you have some type of legal presence in the United States. And then people say, well, this person can get it and they're a refugee from this country. Well, Congress has determined they are in the country legally and they got a green card. You may disagree with it, and in your eyes, that's illegal, undocumented, but they've got documents. So you cannot get benefits if you do not have proper legal status in the United States. Done. Because I've done it hundreds of thousands of times. I had to deny people. Unfortunately, I had to deny people that were in the Vietnam War. This was always the worst part. It usually is somebody from Canada. Their parents came over when the kid was 2 or 3 or 4 years old, and they didn't document things correctly. And the person has been living here since the 60s, and they went to Vietnam War, 2 tours in Vietnam, got the Silver Star and whatever, and then they file for retirement benefits at 62, 65, and don't have legal status in the United States. They've been living in the country and paying their Social Security and all that kind of stuff. They eventually go and get it, and then they get their benefits. But yeah, many people are denied because of that. That was the tough part. But they eventually do get their benefits. But they just have to go get legal status. Spouse passed, was receiving SSDI, never applied for SSA. Would I have any survivor benefits? Yes, 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 absolutely. But so once you hit 60, you can go ahead and file for survivor benefits. You don't have to file for benefits on your own record. That's one of the exceptions. Normally, when you file for spouse benefits or divorce spouse benefits, you have to file for benefits on your own record and then benefits from the spouse. But in terms of surviving spouse benefits, you can just file for surviving benefits and not file on your own. SSA doesn't want to get any back pay from SSDI. I have my hearing next month, but I'm sure they denied me. Yeah, well, you've got your hearing next month, so yeah, hopefully you've got a good lawyer to walk you through there. The reason I recommend a lawyer is because these ALJs, the administrative law judges, they are completely booked up trying to keep up with the backlog. and they don't have enough time. They don't have that much time for the hearing. So you might have a hearing, and then an hour later, they've got another hearing they have to deal with. So if they're spending all their time explaining to you all of the acronyms, what's SGA, what's the IRWI, what's the DLI, and all this kind of stuff, and you don't keep on track, then yeah, unfortunately, yeah, they just might deny your case, lack of evidence, or iffy evidence. That's why I recommend a lawyer when you hit that particular stage. So hopefully, yeah, you hit that. Hopefully, you're approved. The ALJs have a lot more latitude in reading between the lines. So good luck. Let's see. What year do I have to file for Medicare? Yeah, when you're 65 years old, or if you're already receiving Social Security benefits, then you don't have to do anything. Your Medicare starts automatically when you turn 65. If you're not receiving Social Security, then you have to actually file for Medicare about 2 or 3 months before you hit 65. Can you get an increased Part B decreased after your income drops off? Absolutely. So you're talking about the IRMA, income related monthly adjustment amount. So yeah, a lot of people are paying way too much for that, and because they don't know. So IRMA, that extra Part B premium, is based on your earnings from 2 years ago. If you have since stopped work, then you need to file an SSA 44, a life, and report a life-changing event and say, yes, I made over $103,000 2 years ago, but I stopped working last month or last year or whatever. And then they will readjust your Part B to the regular amount. So yes. And even if they increase your Part B, and because you did get that money and you're still working, it'll only be for 1 year. And next year they'll reevaluate it again. So waiting on widow pay. What is stage 3 of the process? Yeah, I applaud Social Security for trying to try to give you kind of a stage of your application. Disability is 9/10 done or 2/3 done and stuff like that. But yeah, it's kind of like when you're downloading an app on your phone or something like that, and it says 10% done, and then 20% done, and then all of a sudden it says 80% done, and it goes back to 30% done, or it sits at 80% for like 6 hours, and then it goes to 81%, then it goes, yeah. So it's kind of like that. So stage 3 is, I guess, conceivably they got all the documentations. They're just waiting to push the button, but that stage could take 5 times longer than all the other stages. So yeah, good job, Social Security, attempting, but the execution, it's just, yeah, yeah. I had no idea that I could get SSI until I heard you talk about it. Oh, good, good. I called Social Security and she said she could not tell me the amount, but I would be getting a letter telling me. I'm a very thankful 66-year-old. Yes, awesome, good deal. And again, don't thank me. Thank all the people, the Imaginator and Take and Took and Sweet Pea and Penelope and all those people, all the regulars, and all y'all that are going to press the like button and subscribe and share and all that kind of good stuff. Those are the people that got this video, this channel to you. So thank them, and awesome. So Gloria, basically what it is SSI is supplemental security income. It's not Social Security. It's administered by Social Security, but it's a program Social Security took over 1974, 50 years ago today, this year. So it's a welfare-based program. It does not come out of the trust fund. And you get SSI because it's a welfare-based program, low income, low resources. And there's 2 ways you can get it. You can get it based on a disability, or you can get it based on being aged, that is 65 and older. So it looks like Gloria got it based on aged. So what it is, if you're receiving Social Security benefits, retirement, survivor, spouse benefits, and your benefits are below $943, then you apply for SSI, and then you can get the difference. So if you're getting $500 from retirement on your own, and then you start your SSI, you'll get another $443 from SSI. Again, you have to have low income and low resources. And in some states, if you're like living in California, they also pay an extra $200 or $300 above that. And then remember, Gloria, if you are receiving SSI, then you're also categorically eligible for Medicaid. So if you're not already receiving Medicaid, please file for Medicaid, and they will also pay for your Part B premium. So that'll put another $174.70 in your pocket. And then if you have both Medicare and Medicaid, you're dual eligible because you can't have both. So you're going to have retirement benefits, SSI, Medicare, Medicaid, and then you can get one of those Medicare Advantage plan, the dual eligible, which if you have both, I highly recommend because those are the ones with the extra benefits, the over-the-counter drug card and the grocery card, and it depends on your particular area what's available in your area. But if you've just been approved for Medicaid, yes, you definitely need to switch to one of those dual eligible plans. And again, you can click on that little QR code or email me and say, hey, I just got approved for Medicaid, or a lot of people that lost Medicaid. If you lost Medicaid recently, then you need to switch to a regular Medicare Advantage plan before you go to the doctor and get a surprise. All right, widow pay. Why would they use mine and make up the difference with my husband's? Yeah, that's basically what they do. If you are already receiving benefits on your own record, and let's say you're eligible for $1,000 from your deceased spouse, you're already receiving 500 from your own. You'll continue to receive the 500 from your own, plus another 500 from your deceased spouse for a total of $1,000. And that's just kind of the way they do it. Can I get disability with aneurysm and heart? Yeah, again, file. If you think that is keeping you from work, you do DoorDash, no problem. As long as you're under the SGA, the substantial gainful activity, the $1,550, as long as you're under that, then I would 100% file for disability. Watch my videos on that. Can file online. The reason I recommend filing online is because Social Security is low staffed, 50-year low staffing. And in most offices, I know because I used to schedule, they give you about an hour for a disability claim. And so an hour, to go through all your stuff and your medical and, your doctors and your educational and your work history and all this other kind of stuff, sometimes it takes longer than an hour. And so you're kind of rushed. And so if you do it yourself on the internet, then you're not rushed. You grab yourself a cup of coffee, you get all your prescriptions, you get all your doctor's names and everything. Make sure you watch my videos so I give you details on that, some tricks to watch out for, traps to watch out for. And so you can sit there and you can take 2 or 3 or 4 hours to put everything into the system the way you want it. So yeah, that's why I recommend online. But if you're just not very good at online, then schedule a phone appointment and tell them, don't rush me. Tell your supervisor that you're going to be late for your next interview because I've got something to say. So Deb, 65-year-old, November 2024, applied and got Part A approved, December 2024, last day to work. When should I apply for B or D? October-ish. Yeah, just October, November is fine. Make sure you fill out those 2 forms, the 40B. Well, actually, you're I don't think you're be an issue because you're still in your special November, October. Yeah, so you're still in your special enrollment. You're still in your initial enrollment period. So you can actually, next month, call them up or fill out the 40B and to start your Part B. Because, if you're talking about, December of next year, then you have to take a form down to your employer and they sign off that you had, credible coverage since you turned 65. But in your case, you're still in your initial enrollment period. So you're good. So in terms of so that's the B, and the same thing with the D and the supplement. Right now, actually, if you're going to do a supplement, you can go ahead and start that pretty much right now. Because you're going to get your Part A once you get your Medicare number, which you'll probably get your Medicare number here pretty soon. You get your Medicare number, and then they can sign you up for a Medicare supplement, a G or an N, find the best one in your particular area, and just tell them to start it, January 1st, because that's when your Part B will come. And then when you get Part B, you'll get a new card, a Medicare card. It'll have A and B on there, and the Medicare number will be the exact same one. So the Medicare number won't change. Does severe left wrist qualify? Again, file. I'm 62, works on using my hands, pulling, pushing position. Yes. So file and include any other disabilities, limiting conditions that prevent you from working, medications that have whatever side effects, but apply. Nobody can tell you off the bat. And one of the, I forgot to mention when I was talking about this, one of the things that, the stats are kind of skewed, and lawyers like using the stats because they're skewed, is Social Security employees, their job is to take a disability claim at the first stage like that. And I've had people come in and they say, I want to file for disability. Okay. All right, let's do it. And then I found out their disability is they're pregnant. And in order to get disability, your disability has to last 12 months or longer in the future. It doesn't have to have already last 12 months, but it has to last 12 months, at least 12 months in the future. And in every state in the country, maybe not Florida, but pregnancies don't last over 12 months. But the person are completely adamant that they want to file for disability for, maybe they need it for workers' comp or work or whatever the case may be. Who knows? So I take the claim. Okay, what's your disability? I'm pregnant. Is that going to last 12 months or low? No, denied. And that goes into the stats that, this many cases are denied. I've had people with broken arms that, it's, how long going to be out? Oh, 6 weeks. Social Security doesn't have short-term disability. I don't care. I want to file. Okay. And then you're denied the first thing because you've told me that it's not going to last for over 12 months. So that's another reason why it's, the numbers are kind of skewed. My brother filed for early Social Security retirement, but then chose not to take it. He never received any benefits, was told by the people at his office he could not have over $2,000 in his accounts and $700. So yeah, that's not retirement. If someone told him that he cannot over to have $2,000, then he filed for SSI, which is a welfare-based benefit. So yeah, check with him and find out what he did, because yeah, that's not retirement. That's SSI, the welfare-based benefit. Because if you're filing for regular retirement, survivor benefits, spouse benefits, regular SSDI disability, you can have $1 billion in the bank and nobody cares. But you're going to buy me a coffee down below, right? Anyway, I just got to notice that some things are changing in my Advantage plan. Coverage goes down. Yep. And over-the-counter monthly goes up $28. I can't wait to see what the experts have to say. Yeah, and see what else is available in your particular area, because these companies compete. So they're always trying to keep up with the Medicare insurance company Joneses, I guess, right? If you are going to be having my people help you out, please let me know if they don't treat you right, because they will be down the highway. My 35-year-old disabled son, Down syndrome, lost his father. He was able to work for a number of years, so he was collecting SSDI. Is he now eligible for his father's survivor benefits that he is large? Unfortunately, no, because in order to get that type of benefits from a parent, then it's called a disabled adult child. You had to be disabled. You had to be considered disabled before the age of 22. And him becoming eligible for benefits on his own record prove that he did work for a number of years, so they would consider him not a disabled adult child, unfortunately. Yeah, it's yeah, kind of sucks that obviously he pushed through and worked and did the right thing and all that, and now he can't get those benefits. Yeah, I agree. Tammy, if you're on disability, can I also draw on my spouse's retirement, even though he isn't drawing yet? No, but halfway there. If you're on disability, you can file a claim. You can receive benefits from a spouse, ex-spouse, divorced spouse, surviving spouse, and all that. But in terms of your ex-spouse, if he is 20, if he is 62 years old, then yes, it doesn't matter whether he is receiving benefits or not. This is called so many people miss this. Independently entitled divorced spouse benefits. So as long as that person is 62 years old, at least 62 years old, then you can file for independently entitled divorced spouse, and they do not have to be receiving benefits. And unfortunately, people go, I tell people that every day, and people come back and they say, Ed, I went to the local Social Security office and they told me you were wrong, that the person had to file. And what they're doing is they're going to the Social Security office and they're talking to the people at the front window, and the people at the front window are awesome. They're overworked, underpaid, but they are not experts in Social Security retirement benefits. So I just put the reference. It's called independently entitled divorced spouse. So that's the reference. So when you go into local Social Security office and want to file for that, and they tell you no, then you show them that reference, and then they will say, "Oh, I didn't know that." So then you tell them to go get training. So let's see here. I am continuously in step 3 from SSDI from June 2025 waiting. Yes, yeah, yeah. So again, it's, yeah. But one thing I would do, if, again, what happens is you take the claim, you at the local Social Security office, they send it up to the DDS, the state agency does their things, and then they send it back to this local Social Security office where you took the claim. But along the way, sometime what happens is quality review. The quality review pulls it out and looks at it and makes sure all the, the I's were dotted and the T's were crossed and everything. And then that might take a while for them to do. If there's something wrong, then they send it back to DDS to correct it, and then DDS is supposed to send it back. But what I've found, doing this several 100,000 times, is somewhere along the lines, they don't pick it up. They don't resend it or something. So what I would do is I would call probably probably the DDS. Call your state DDS, Disability Determination Services, and ask for the examiner that's working on your particular case, and say, "Hey, how's it going? Just want to check the status. What's going on?" And if they say, "Oh my gosh, I forgot to send it back," or yeah, then it'll get going. So yes, check on the status. Poke them with a sharp stick. Megan, if someone got disability because they have COPD and emphysema and was told to quit smoking and they refused to quit, should they still be able to collect disability? Yeah, that's yeah, uh, yeah. There's a lot of things that people have disabilities for. It is kind of lifestyle choice, I guess. So I don't know how much Big Brother we want to go down there, and it's like was it the movie Casino, where the Robert De Niro had the showgirls, weighing themselves every week, and so yeah, I don't think we want Big Brother doing that. So it's one of the unfortunate parts of, yeah, but do we want, yeah, anyway? So it is so confusing. Yes, SSDI, SSDI, SSA. I get it now, but I do not work for Social Security, so many people do not know what the symbols mean. Thank you for your help telling more people. Yeah, you're welcome. Thank you. Thank you for taking the time to write that. I appreciate it. Yeah, it's yeah. There's many more acronyms, and I've got even more acronyms because I was a sergeant in the Marine Corps. So anyway, yeah, yeah, Megan. I don't know if they should, yes, quote unquote, but I'm pretty sure they will continue to get it. Yes, yes. Don't give up. Keep at it. Yes, perfect. Yes, exactly. It's the bureaucracy. You have to deal with it. Just keep at it. If you get denied the first stage, thank you, Susan, for pointing that out. If you get denied the first stage, fill out the SSA 561, request a reconsideration. Just keep doing it, because once you get the administrative law judge, as I mentioned, the administrative law judge has a lot more latitude to kind of read in between the lines, and so there's a lot of people that get approved at the administrative law judge. So keep at it. Please, please, please keep at it. And if the ALJ, the administrative law judge, approves you and says, basically says, "Hey, Social Security, you messed up big time. You should approve this person 2 years ago," they will give you that 2 years of back pay. So that 2 years of retro. We get people all the time. "Oh, I just got a $30,000 check," and so yes, yep. Susan, the more documentation, the better. I got my disability the first try. I had cirrhosis, wasn't supposed to live more than a year. 2020 liver transplant. Oh, well, thank you for still being here, Susan. Keep it up. Yes. And thank you for, yeah, people get approved first time all the time. So let's stop that internet myth. People just like being negative, don't they? Yeah. I'm on disability for 20 years. My ex-husband married over 10 years, just retired. Am I able to get his? Yes, if your ex-husband, doesn't matter. If your ex-husband, as soon as your ex-husband turned 62, you were eligible to receive benefits on that record. If that your ex-husband's primary insurance amount is twice yours. That's the key. It has to be twice. So if it's twice your amount, then you get essentially the difference between that and what you're currently receiving. So, and you're like, well, how do I know if it's twice the amount? Call Social Security, give them the information and say, I want to see if I'm entitled to any benefits on my ex-husband. Here's his social. If you don't know his social, no big deal. Just give them the name, date of birth, where they were born, all that as best as you know it, and they'll be able to find the Social Security number. I've never not been able to find someone's Social Security number. Are you able to collect Social Security retirement benefits and widow's benefits at the same time? Yes and no. And this is something that people unfortunately get wrong all the time, and it really hurts them later. So if you're currently receiving retirement benefits on your own record, $500, and then you're eligible for $1,000 from your deceased spouse or divorced deceased spouse, then you get the difference between yours and that. So you're entitled to $1,000, so you get $1,000 minus your own. So technically, yes, you get your own retirement benefits, 500 plus another 500 from your deceased spouse for a total of 1,000. So technically, yes. But in practice, what you're asking is, can you continue to get your $500 plus $1,000 for a total of $1,500? No. And that's where a lot of people, particularly couples, schedule and plan incorrectly, because they hear that, well, when my husband passes away, I will be able to get his check. That is correct, but minus your own. So they think, oh, I'll continue to get my 1,000 plus another $1,500. So we got $2,500 coming into the house now. When he passes away, I'll be able to get that check, and it'll still be $2,500 coming into no, that's not it. You'll continue to get your 1,000 plus extra 500 for $1,500. So you'll lose essentially $1,000 coming into the house. It's unfortunate. And I can't tell you how many times I've had to break the news to people sitting right there in front of me at the Social Security Administration when I took a survivor's claim, and they say, what? I don't get that. Well, you technically do get that check, but it's minus your own. So, and yeah, and then the $255 to $55 lump sum death benefit is, and yeah, I was reading there is a movement to increase that. I'm going to do a video on that here in the next week or so. If I get alimony, would that affect how much I would receive when I file for my ex's Social Security benefits? Nope, not at all. Alimony does not count at all. But one thing I'd watch out for is some sneaky ex-spouses and their lawyers try something sneaky by putting stuff in the divorce that says, you don't get the car, you don't get the dog, and you don't get my Social Security benefits. First two, okay. Last one, BS. Doesn't apply. They can write that all day long. Social Security, when they ask for your divorce decree, they need the plaintiff, defendant, and when you were divorced, that's it. They don't care about anything else, any type of, you don't get my benefits. Social Security doesn't care. That's not relevant. So there's a lot of people out there that are not getting divorced spouse benefits because they think they can't because they signed to it in the divorce decree. Nice try, but no. So if you know anybody like that, we really need to, get people out there. And VA hospital and quit. The 7-year nurse get benefit stroke. Okay, I'm not sure what that means. I just turned 50 in June. I'm not sure if I can draw my husband's. He passed in 2009. No. unless you are disabled. Disabled widows can get benefits from 50 to 60 years old. So if you're disabled, then you need to file. It's called a DWIB, Disabled Widows Benefits. But if you're not, then you have to wait till you're 60 years old. 60 is the earliest you can file. When filing for disability at 33 years old, which determines your official filing date, the day you call them for an appointment or the day you fill out the application online, whichever is soonest. So yeah, that's a protective filing date, and good on you for getting that. Yeah. So if you're going to file for disability and you're like, yeah, I want to go, don't wait. Call immediately, if not sooner, because that determines. So right here is the end of September, and you're like, well, I'll call next month when I get this document or that document, or when I get some time to do that. Or no, call up right now and schedule the appointment, and that way you're protected for September. And then later, if then you want to start your disability application online, to go ahead and start it online. Start it and finish it online, and then cancel your phone appointment or use your phone appointment to ask other questions or whatever. Because if you schedule a phone appointment now, you're not going to get it for another month or so. But you're protected. As soon as you call Social Security Administration, you're protected. Even if it takes you 2 or 3 months to actually get the appointment, you're protected for September. So, and that's when they can start your benefit. Husband started collecting Social Security after full retirement age. I'm so overwhelmed. Advantage plans will pay premium. Most Medicare Advantage plans do not have a premium for now. 10 years ago they did, and another 10 years they might, but right now most of them don't. And the Part B premium, is that what you're talking about? There are Medicare Advantage plans. They're called Part B give back, and they depends if there's one available in your particular area. But yeah, they can very well pay for part of your Part B premium, $50, $100, all of it. So you get your Medicare Advantage plan, you get some dental, you get a gym membership, you've got covered for the Part A and the Part B gaps, and you get your Part B paid for. But I caution you on those. If you're healthy, absolutely. Because these giant Medicare insurance companies don't get to be billion-dollar companies for nothing. If they're going to give you essentially free money, even though they're paying it out of your FICA taxes that you paid for decades, but if they're giving you that money every month for basically free, they're going to take it out of other places. So instead of $100 for a normal plan for per day per hospital, they might charge you $500 or charge you more for prescriptions or whatever the case may be. So yeah, a lot of people sign up for those, for the first year when they're young, 65, 66, and get their Part B paid for and get some extra money in their pocket. But when they start getting sicker, then switch to another plan that covers more of what you're looking for. And that's a good way to do it anytime. Is okay, next year I've got a bunch of dental stuff I need to get done. Find the plan with the best dental plan and get your dental stuff done. And then next year, you're like, oh, I need surgery next year. So let me find a plan that, has the lowest, surgery or the lowest, in night of, per stay of the hospital per night. And then, so you change your plan. Again, this is your money. Go out there and get your money, so do it right. It's not like car insurance, where you had the same car insurance for decades and decades and decades. So at least I have. But anyway. I'm not sure if he paid enough in. He was 38 when he died. Our divorce was final for 3 days before he died. So you had to be married to the person for 10 years because you were divorced. Yeah, wow. But when someone dies younger, they don't necessarily have to have the full 10 years. So there are exceptions to that. So I would definitely call. Again, if you're not disabled, then wait till you're 60 and see if there's any benefits available there. If qualified for SSDI for immune disease but went back to work, now turning 62, do you qualify? But went back to work, now turning, yeah, well, you still qualify. 62, you retire for straight old retirement benefits, so you can file for those. But now if you're not working or again staying under the substantial gainful activity, then you can go ahead and file for disability benefits. So absolutely. Doesn't matter whether you filed before and were denied, file again. All right. All right. We are over an hour. That is it for today. If I apologize if I didn't get your question today, I will be back again tomorrow. Yes, I'm going to try to do this every day. I might miss a couple of days here in a few weeks, but I'm going to try to do it almost every day until the rest of the year. A lot of people out there need information to get what they're entitled to. So here's my new mission in life.